Hello, my name is Evelyn, your nurse. I am here to help you learn how to care for yourself and your loved ones after one having a stroke. Today, I will be talking about two important topics, that's the feeding and mobility. So first, let's go to feeding. Due to memory and thinking problems, some people do experience difficulty swallowing or even forget how to even eat with their hands after having stroke. To make feeding easier and safer, let's consider these things. Like one has to sit upright. When consuming food or liquid, always try to sit upright. Choose choking is less likely as a result of sitting upright. And secondly, you eat in a small bite or maybe a sip. Patients are encouraged to eat a tiny bit. Food may need to be either softened, maybe chopped or pureed, or maybe the fluid could be thickened, depending on the individual needs. And this makes you also remember to always slowly sip without rushing. Thirdly, one has to have a special utensils. If one finds it difficult to hold a spoon or fork, there is this special utensils with large handles that makes it more manageable. 4 is you verify your swallowing issues. Stopping eating and inform your doctor or your nurse immediately if you are experiencing cough or choke. You could be required a different diet, so it's very important you notify them. And then lastly, on my list, you take your time. You go slowly. Choking could be avoided in so many ways, especially in slow eating. So I think this is the last one, and I want you to demonstrate to me how you would sit up and eat and then drink. Okay, well, fantastic. Okay, sit upright. Wow, always remember that. Always remember that. And also take tiny meals and sit upright, straight. Okay, thank you. And so we move to mobility. Mobility, one of the main causes of adult impairment is stroke. Initially, about two-thirds of stroke victims experience impairment in mobility. It is crucial to move around carefully after a stroke, since it helps patients regain their movement, improve their balance, and also prevent falls. And these are some of the tips to help. One is you use your mobility as an aid, or maybe you ask for help. As advised by your therapist, you would be given either a walker, a chair, wheelchair, a cane, whilst walking. And this is very important to always use it. Never assumed you could walk around without the devices. And most importantly, always remember to call for help. Don't be scared. We are here for you. Secondly, environmental safety, or maybe we clear path. So to reduce the risk of falls, we always have to make sure the environment is safe from wires, shoes, rag, anything that would be in the hallway. Okay. Thirdly, you always have to wear a non-slip socks or shoe. Make sure you are wearing your slippers or maybe your shoe with non-slip soles, which I will show you later. And then, medication and lifestyle, that's the fourth one. We always recognize how drugs can help control symptoms. And so it's embracing a healthy lifestyle to aid in healing. So we always also have to remember our medications and then the symptoms that comes with it. And lastly, that's the fifth, we perform exercise. During therapy, your therapist will advise you or give you an assignment to exercise. We recommend that you, because this helps you get more stronger, so we recommend you aim to complete them each day as been assigned by your therapist. Okay, so now can you demonstrate for me how you would get up using your walker now, since I see you have a walker? Okay, all right, good. Okay, that's fantastic. Always try to take your time like you did just now. And if you can't and you feel any weakness, you try to call for assistance and for you to feel stable. Okay, if you know you don't feel stable, you always try to call for an assistant. Okay, so let's look at let's review it, or let's go over it again. Let me ask you this. So what should you do before consuming any food or liquid? Okay, good. And then secondly, when going around the house, what should you be aware of? Okay, wow, okay, right, okay, good. Do you have any question for me? All right, okay. So please remember to contact your nurse or the doctor or myself for any further questions that may come later. Okay, our goal here is to keep you healthy and safe. Okay, all right. Thank you and have a nice day. I see you later.